2. Thermotherapy, or the use of either superficial or deep heating applications in the treatment of physical conditions.
Now we're continuing to talk about the use of therapeutic modalities in terms of treating patient conditions. And we're moving on to heat. And once again, I have these gel packs in my hands that come in various sizes. And they do serve double duty in that they can be both cooled, used for cold therapy in a freezer, or they can be heated in a microwave and used for heat therapy. So now for purposes of simulation, what we're doing is just assuming that we've heated these in a microwave and we're ready to apply these heated packs, hot packs, to the patient. So once again, we have to make sure that the area itself, the area of treatment, and once again we're utilizing the elbow as the area of treatment. And now I guess what we're essentially saying is that we have a chronic condition in the elbow. That's a condition of pain and discomfort to the patient, and we want to apply some heat treatment. Another example which we could be using heat treatment would be maybe we have an older patient with osteoarthritis, and so we're going to apply heat to that area. So once again, we apply a protective barrier directly over the elbow area, and then whatever size heating pad we determine is appropriate for the area of involvement. Might be a very small localized area in which a small hot pack would work. We may need a larger hot pack in order to cover that area. So we place that on there like that. And we do have a lot of choices in terms of how we apply heat. And for example, I have a beaded pack here. This is also microwavable. And once it's placed in a microwave and heated, then it can be placed directly over the area of involvement. So that's another form of heat. There are also chemical hot packs that can be utilized. And that's just simply a pack that you purchase through a medical supply house or from a pharmacy. And simply by crushing the pack will heat, and then it can be applied directly to an area of treatment. We also have larger packs, similar to what we used on the hip area. So if it was an area of osteoarthritis in the hip, once again, I would properly drape the area, and then I would apply a larger heating pack to that. These items here, these are all microwavable. We also have the option of using different types of electric heating pads, and one of the various kinds is called a thermophore, and this is a type of heating pad that will actually apply moist heat, because whenever possible we do like to work with moist heat as opposed to dry heat, which may cause some circulatory congestion in an area, so we prefer to use moist heat whenever possible. But a heating pad this size can cover an entire area such as the hip and leg. When we utilize a heating pad like this, we will use, of course, appropriate draping and protective barrier against the skin, which we'll be demonstrating in just a moment. But let's continue on with the demonstration of heat being utilized directly over the elbow area. So we'll use a gel pack again. We'll place the gel pack directly over the area to be treated, and then once again, we'll take a towel. We'll place that over that. And the purpose of the towel is to apply an area of insulation to retain the heat, so that the heat itself for that 20-minute treatment period is actually able to radiate into and to penetrate into the joint that's being treated.
The physiological effects of heat include decreases pain, decreases muscle spasm, decreases chronic inflammation, increases circulation and vasodilation, increases joint range of motion, increases tissue extensibility, and promotes overall patient relaxation.
So we're continuing to talk about the application of therapeutic modalities, and specifically the use of heat. So once again, we are modeling and simulating a treatment to the hip. And as indicated previously, we've not had the patient disrobe. So we're actually applying this through her pants. But we're using, again, the protective barrier. So once again, we would use proper draping. And in order to use heat, we would not apply the heat source directly to the exposed skin. What we would do is we would create a barrier of some kind. Now in this case we're using a pillow slip, but in other forms of treatment what we might be using is a piece of plastic. And we utilize a piece of plastic as a barrier between an electric heating source like a thermophore and maybe some type of an application of a liniment or medicated oil, or perhaps in the case of using a castor oil pack, where we'd actually have an oily or liquid-like substance on the skin, and we would have to protect the heating source from contact with that. For example, once again, if we were utilizing the thermophore, we wanted to cover a large area, we'd have to have this area of the skin protected, the thermophore protected, because it would be damaged by oil or some type of a liniment again, or a medicated substance. We would not want that to get into the thermophore. And of course this is electrical, so we don't want anything liquid to short out the wiring, which would be a shocking experience for the patient, to say the least. If we want to avoid the use of an electrical device, once again we can go to these larger gel packs, which we can microwave. And again, if we were going to utilize some type of a medicated oil or a liniment type substance, which would be applied directly to the skin of the patient, we create this plastic protective barrier here again. And this can be plastic sheeting that you can buy in a hardware store, or it can be anything as simple as just cutting up garbage bags into appropriate size sheets of plastic, and then directly applying the heat source so it is over the plastic. And then once again we need an insulative barrier in order to retain the heat. And in the case of heat, again, this could be several layers thick. This could be 1 layer to 5 layers of toweling, depending on how much of that heat you want to retain, how long you want to retain the heat. Normally 20 minutes is what you're talking about. Plus, once again, we can bring in, along with this heat therapy, we can bring in a thumper, and we can apply the percussive treatment directly along with the heat. This is very relaxing. If you've got an area where you have muscle spasms, stiffness, and pain, the combination of heat, combined with percussion, will go a long way to relieving those conditions. Now, in addition to the various methods that I've shown of being able to apply direct heat, I also have here today with us the infrared lamp. And the infrared lamp is sitting right here. The infrared lamp is a nice device because it's a great way to apply a nice, deep, even, penetrating heat to any area of the body, because the lamp itself is quite movable and flexible. The head can be turned and applied. What we do in terms of determining the distance to apply the head to the skin is we apply it after the lamp has been turned on and it's heating, which obviously this lamp isn't, or I wouldn't be touching it here. And then applying it here and then feeling the skin with our own hand and just feeling that for just a few seconds to determine if it's a nice, comfortable level of heat. One of the problems with infrared heat is that it can kind of create some hot spots, because one area may be a certain level and distance from the lamp, and another area might be higher. And so actually higher or closer to the lamp. So we need to check for those high areas and make sure that the highest area is the most comfortable area of treatment. And the other is that infrared lamp can be itchy. Can create an itching sensation in the skin. So again, we want a nice, comfortable level of heat, not too close and not too far. As Goldilocks said, it has to be just right. If I can bring your attention again back to the hip area, one of the things that I brought in here along with this simulated heat treatment is I did bring in my double duty bag again, which serves not only as a microwavable bead bag, but it also serves as a nice weight in order to use over my gel pack, which is under here somewhere. There's a gel pack, just to create a little bit extra heat, a little bit extra weight in order to retain the heat in that area right over the hip joint where I'm simulating the treatment.